Next, from Springfield, we get a review of how the state did in the fiscal year that ended on June 30th. Did the state actually have a balanced budget? We learn more as we talk one-on-one with Dan Long, Executive Director of the Commission on Government Forecasting and Accountability. This runs about 30 minutes.
Dan Long, Executive Director with the Commission on Government Forecasting and Accountability, better known as COGFA. We appreciate you joining us again on the Illinois Channel.
Well, it's nice to be back, Terry.
We thought as we are here at the end of July, it's July the 31st as we take this, the fiscal year of 2012 ended just a month ago, and we wanted to go over some of the numbers and kind of get an up-to-date view of where the state is heading financially and what progress, if any, has been made. As we now look at fiscal year 2012, which again ended June 30th, how have we done, and to what extent has the state been able to move towards a balanced budget?
Well, 2012 was a good year. We took in $33.7 billion in the general fund, which on a net basis is about $3.3 billion above fiscal 11. That was driven primarily by the full year of the income tax increase, and income taxes on a net basis came in $4.3 billion above fiscal 2012. Corporate income tax was up $600 million. And then sales tax also has been performing quite well. It's up almost $400 million. Now that the income tax was up 38%, corporate was up 33%, and sales was up about 6%. So we were able to pay down some of the backlog of bills, although there's still a large amount that remains. But I think that we're making some progress.
How much were we able to pay down of past bills?
According to what the comptroller has been reporting, about maybe $500 to $1 billion. We carried over about $8.5 billion coming into fiscal 2012, and it's estimated we'll carry over into 13, $7.5 to $8 billion. So we're able to control spending and use some of the revenues to pay down some of the backlog of bills. Now we still have a long way to go. And fiscal 2013, there's still going to be significant payment delays because $7.5, $8 billion is still a lot of money, and that is reflected in Medicaid bills, bills that are related to state employees group insurance program, and corporate income tax refunds, which are owed, which are probably $500 million.
Of that increase in revenue, I don't think anyone's surprised that the personal income tax went up with the increase in taxes. Do any of those other numbers, the increases, were they a surprise to you? Did they exceed your expectations?
You know, sales taxes performed remarkably well. Certainly in the first 2 quarters of the year before we kind of hit a soft patch, but income taxes have been quite resilient, in part a result of increased car sales and bigger ticket items. And we're not sure if that's going to continue into next year. And into this fiscal year 13, but we're somewhat hopeful that it will still have growth there, but maybe not at that level we saw in fiscal 2012.
I don't know if you know the answer to this, but recently the federal government came out and said that the gross domestic product, the nation's growth rate, was down to 1.5%. You use some kind of a growth rate in your financial forecasting. What growth rate are you using, and how recently was it adjusted?
Well, we use Global Insight, who's a nationally recognized econometrics firm, and we would use their number, and that would reflect that 1 to 1.5% is what we utilized. And 97% of what happens in the national economy impacts Illinois' economy. So if the national economy is not performing well, Illinois' economy doesn't perform well either. In fact, we've been the unemployment rate in Illinois has been higher than the national rate now for quite some time, even though it's come down a little bit. But we still have the unemployment rate in Illinois is still higher than the national rate.
I want to dig deeper into some of the numbers, but before we do, again, talking about the dollars and the state able to pay down some of those past due bills, to what extent was that a reflection of the rise in income tax, maybe the economy doing earlier better than expected? To what extent would it have been flowing from legislative actions, to the extent that they're being more disciplined in not increasing spending?
Oh, I think all of it. This year, the first time in many years, the legislature actually adopted a joint resolution, or House resolution, that set what they believe would be the revenues. And it was a fairly conservative number, maybe slightly lower than even our revenue estimate. And then they appropriated money based on that revenue estimate and set aside some to pay down the bills and stayed within, very much stayed within that, the estimated revenues, the appropriations.
I'm sorry, how is that compared to previous years? They apparently didn't take that path?
Well, in previous years, they haven't adopted a revenue estimate first. I mean, it just kind of went to the appropriation committees and they
Is it spend first and hope for the best?
I mean, they relied on our revenue estimates to a certain extent, but really it wasn't, there was probably more spending, sometimes certainly exceeding what the revenues were in a fiscal year, or they may have adopted a revenue estimate that was certainly higher than what revenues were going to actually be. So they did that in fiscal 2012. They also did it in fiscal year 2013. They used the same process, and the appropriations actually this year are about $500 million less than they were last fiscal year, around $29 billion. But there's about $500 million that they're going to transfer in order to pay down the backlog of some of the backlog in the Medicaid program.
Now, again, we'll get into some more details soon, but on that growth rate, I mean, if the economy were growing, if we were doing the same thing, putting a lid on spending, et cetera, that you just referred to, but the economy was growing at 3 or 3.5 or 4%, we would probably get back into financial balance obviously far more rapidly. When you sit here at the beginning of the fiscal year 2013, we're in the first month that's just completed of that, what number of growth rate are you using going forward, and how often would you update that?
Well, we've made the projections for this fiscal year based on the economic data that we have available. We review it and adjust it every quarter. So if there's a significant slowdown, well, then we would have to adjust our revenues. But we feel pretty confident based on the information that we have available to us, unless we would slip into some type of recession, which we don't expect. We use some fairly conservative estimates.
Everyone knows the state has a major problem with pensions. They may or may not be as focused on the problem we also had with Medicaid. Both of those issues were on the legislative agenda this spring. The governor, as we speak, is going to be having the legislature come back in August to address the pension issue and see if something can be done on that. Have you run the numbers on any of the changes within the Medicaid system? They increased the cigarette tax. They're hoping to get the $350 million in new revenues and a match funds. How does Medicaid, it seemed the big cost factors in the budget, aside from education, are Medicaid spending, just healthcare spending for employees, and the pensions. Would that be correct?
Yes, that's the major drivers of the pressures, I should say, the spending pressures that you see.
And the bills, where would you say of those three, Medicaid, healthcare spending for people, and the pensions, how would you rank them as far as severity of a problem as far as expenditures?
I think that the Medicaid liability is clearly the one that was growing the fastest, and why the governor determined and the legislature took action to try to reduce those liabilities and cut the Medicaid spending by 2.7 billion. Half of that would be federal reimbursement, so about 1.3. They made some reforms. I think they're going to try to make individuals recertified to prove that they're still eligible for the program. And then they actually reduced or eliminated certain optional programs within the Medicaid that the state pays for. So I had to get control of Medicaid spending, and then pensions is probably second.
Have you incorporated any of those savings into your fiscal 2013 budget, or do you kind of wait to see how it shakes out?
We'll focus more on the revenue side, so it wouldn't impact the revenue side, but it clearly impacts the spending side. And I think the legislature clearly incorporated those into the fiscal 13 budget, because revenues, now that we've got a year of the income tax under our belt, and because of the way it was structured and starting halfway through a fiscal year, and it pushed like 500 million into fiscal 2012 as a one-time type of revenue stream as a result of companies not getting the tax tables changed, and so that these people had to make their payments when they filed their income tax returns. You won't see that again in fiscal 2013. You're not going to see this major revenue growth between fiscal 12 and fiscal 13. It's pretty much the same. And so it was very important, I think, that the spending issue be addressed and the spending be reduced.
I think you said earlier on when we started, I don't know if I have the number right, was it the revenue to the state for the year that just ended was at 33.7 billion?
Correct. Mm-hmm.
How did that compare with the previous year?
It was about 3.3 billion higher than fiscal year 2011. Again, the income tax started halfway through fiscal 2011 in January. By the time it got passed, by the time that the various companies and actually got their tax tables changed and that type of thing, some of that revenue didn't start streaming in until a couple months after that. So that when it came to final payments, individuals ended up paying more because the tax had increased even though the deductions hadn't been made from their paycheck. So it pushed some of that revenue into fiscal year 2012.
Pensions, again, big cost factor, massive unfunded liabilities going forward. The state trying to deal with that. The expenditures, I understand, for fiscal year 2013, which we just began on July 1, would be a total of $5.9 billion. Now, in the past, the state had to borrow that, and as I understand it now, at least the state's able to pay that, so they're not digging themselves deeper into the hole. Is that right?
No, that's a really important point. One, the pension liability has been going up. I think the general revenue component of the 5.9 that you mentioned is about 5.1 billion is what's built
coming out of general revenue
right out of GRF. Now, in fiscal 2010, that was about 3.5 billion, and we borrowed it that year because they took that money and used it to increase spending in some programmatic activities that they didn't want to reduce spending. And when we got to 2011, well, we obviously didn't go up 3.5 billion in revenue. We borrowed about 3.6. So over that 2 years, we borrowed 7.1 billion. And that's why when we passed the income tax increase, the first 4.5 billion had to go into the base to pay the pensions. And then we have debt service on those pension notes that we borrowed over those 2 years of about $1 billion. And that continues until 2019 before that's all paid off.
So another 6 years.
6 years, and even though the income tax is scheduled.
By the way, is that a flat rate payment or does it decline every year? And what I'm getting at is when we get to 2019 and it goes away, do we suddenly have, how much more revenue would be available?
Well, you'd have $1 billion, right around $1 billion. I think it's just slightly less than $1 billion for the debt service in 2019. And again, we borrowed twice, so you're paying off over 2 years, are paying off $7 billion that was borrowed over 2 fiscal years. So the first 2 years of the second borrowing, we just paid interest. We didn't pay any of the principal. So that's how that works. But yeah, you have $1 billion that's now going to pay off short-term debt that we'll be able to utilize for other purposes. The problem is, as we've discussed, that the income tax is scheduled to decline from 5% to 3.7% beginning in January of 2015.
From 5%, let's do that again.
5% to 3.7%.
To 3.7%. Mm-hmm. And have you run the numbers of what the income would be if it fell to, as scheduled, now to 3.7?
In the first, in a full year after that decline, say in fiscal year 2016, it's over $4 billion.
$4 billion drop. Now,
right.
Let me put that in context, too. As we look forward on the pension payments, as we said in 2013, the current year that we're in, $5.9 billion. In 2014, a year from now, it goes to $6.1 billion. This is total pension payments. Mm-hmm. And in 2015, it goes to $6.5 billion. So in 2015, it will be approximately $1.6 billion more. And that's just when the income tax kicks off and you lose $4 billion.
Right, you have that cliff effect.
Obviously, it's obvious, but what's that going to happen to the state budget if?
Well, there'd have to be significant reductions. And the reductions would have to come where the spending occurs, and that's not only just pensions, which is hard to, unless you make programmatic changes, it's difficult to reduce. You'd have to cut education, you'd have to cut human services, you'd have to cut public safety to bring the budget in line. So it's either that or or there's a vote. It would require action by the General Assembly to perhaps continue the income tax for a few more years. It's a public policy issue. I'm not sure how it'll be decided, but.
Again, well, we've said before, but we'll say it again, your agency is a nonpartisan, so you don't take sides, but to what extent do you advise members of the legislature? Are you proactive in saying, here's what I would do, or do they come to you? How is your agency used by do they come and say, Dan, can we afford to cut the income tax, or should we extend it, or does that come up?
I think what we do is we provide the information. They have the numbers are out there. We're required to do a 3-year budget projection and update it each year. So everybody's aware that this cliff effect is coming and that you're going to lose over $4 billion. So then it's really, they've got the information, then it's up to them to decide from a public policy standpoint how they're going to deal with that. Are they going to try to continue the income tax for several more years, or continue at a lower rate but maybe not down to 3.7%? Or is it going to be a combination of some reduced spending and a continuation of the income tax? I think there's options that certainly the General Assembly and the governor have. I'm not sure which option they'll take, but I don't think it'll be to just let it completely go away, because boy, it's very difficult to get those kind of cuts. It was difficult enough just to get the Medicaid cuts this year, let alone if you had to cut $4 billion. So it'll be interesting to see how it comes out, and I think it could be decided perhaps maybe in January in the veto session. It may not be decided until the 2014 budget, but at some point it'll have to be addressed.
Another issue that's coming up, and I know some people are, depending upon their persuasion, are working for this behind the scenes at this point, and that would be to have a progressive income tax in the state of Illinois, whereas right now we have a flat income tax. That would have to be a constitutional change, would have to be on the ballot. Well, the earliest it could be on would be 2 years from now, 2 years from this November. Has anyone come to you and say, what financial impact would a progressive income tax have on revenues?
I think we may have looked at it, but it's difficult to do unless you know what are the brackets going to be. It's certainly something we could calculate.
Without hardcore information.
But if you don't know how the tax brackets are going to break out, it's very difficult to project the revenue. So the answer would be we've not done anything yet because we haven't been presented with a plan on how they'd like to proceed.
Has anyone asked you to look at other states that have a progressive income tax versus a flat and see which one maybe works better?
I think in some of our reports we've looked at other states and how their income tax is structured, but nothing really concrete at this point because it's. I suppose it's just too early because you don't even know if it'll pass. It'll come to fruition.
Right. I just want to, on one hand, bring it to people's attention so that they're not caught uninformed. I mean, that is something that, again, certain members of the legislature and other groups are actively working for to have on the ballot 2 years from now.
But then it has to pass.
It would have to pass. The people would have to pass it to change the Constitution and allow for a progressive income tax. So it can't be done in the legislature themselves.
Right. So I think that's a little ways down the road, but
certainly
we could make those calculations once we had some idea of how they'd want to structure the progressive income tax.
But see, we're ahead of the ball, so we're covering issues of the 2014 campaign.
Right. Exactly.
Now, again, going back to Medicaid, and I just relative to the changes that they made, how do you incorporate something like that for financial planning purposes when it's kind of vague when they just make the changes to what end they're going to be able to find that there are people on the rolls that shouldn't be there, or that the revenue?
Well, there's been estimates on how much the savings will be from the changes that were made. And again, this is primarily on the spending side, so it doesn't impact the revenue so much, but certainly it brings the spending more in line with what your projected revenues are going to be, which is exactly what they wanted to do and realized that they needed to do. You couldn't continue to have that growth in Medicaid. So there's been projections on how much the reduction will be, and they ramp up, I think, over time.
And that is a federal program. To what extent do we have the flexibility to cut back on that, or to what extent are the feds mandating expenditures, and that's what's impacting our budget?
Well, we're not experts in Medicaid, but there's certain core services that you have to provide, and then there's some optional services, like dental is one of the things that they've eliminated, and there were some other optional services that the feds don't require you to provide, and they don't reimburse you 50% for those services either. So, like I said, you have to provide a certain core services. There's others that are optional. They eliminated some of those optional services, and I think then the other thing is to make people re-verify that they're still eligible for the program. I think that's a key component. I know that one of several of the legislators were pushing for that because it hasn't been done for quite some time, and there were people added the rules several years ago which may or may not be eligible now. And it's something that I understand other states are doing. They are hiring a consultant that comes in and verifies. And that benefits everybody. If you get people off the rolls who aren't eligible, then it certainly makes it better for everybody who is eligible and makes more dollars available.
And I know it's hundreds of millions, if not billions of dollars that is being spent. I was told some years ago that just one hospital in Chicago lost $50 million just to one hospital from having people come over on Medicaid from Indiana that were being treated.
The Medicaid program's huge. It's what, $11 billion. So it's a very large program, and certainly impacts anybody involved in the medical community, hospitals and doctors and
I know a lot of people just don't have a
pharmacies.
handle on how big the state budget is. I mean, you hear these numbers, but
Well, the Medicaid program is very large, and I get the number of people that are on there, 3 million, I believe, is the number that of people in Illinois that are on the Medicaid rolls.
And now let's go to pensions. One of the major reforms that we've heard is that taking the 3% cost of living adjustment and making it into a simple, instead of a compounded increase, well, let's just take that by itself. Have you run the numbers? We hear that there's somewhere in the area of $85 billion in unfunded future liabilities within the pension system. So the state's trying to address that unfunded liability and by changing the cost of living adjustment, the COLA. Have you run the numbers, and if they made that change, how much of a savings would there be?
Yeah, they're trying to adopt what is in the Tier 2 pension system that took effect in January of 2011, where the COLA is 1/2 the rate of inflation, or 3%, as a maximum. So you'd have to have inflation at 6%. Whereas if people were under Tier 1 and have been in the system for quite some time, you get 3% compounded annually. So the change is to try to say, okay, either you can choose between keeping that compounded COLA or getting your medical benefits from the state. We've only ran the numbers on the state employees retirement system, which is the bill that came over from the Senate. I think it's House Bill 1174. And over time, and this is one of the smaller systems, it would save something somewhere in the range of $23 billion and between now and 2043, and on a net present value basis, about $4.5 billion. The projection for in 2015, I think the savings would be around $200 million to the state in terms of payment, and that's just the one system. Teachers' retirement system is much larger. It has 50% of the assets of all the systems, and even the university system is large as well. So those savings numbers would go up significantly if there's a bill which they're talking about, which would address all three of the major systems, and also including the General Assembly as well. And the General Assembly is included in this latest bill.
So Dan, one of the issues, we were talking about COLAs and the adjustment and going from that compounded to simple. In a rough approximation, I know we're looking out over decades of how much this would save, and so it's hard to come up with a hard and fast number. Approximately, how much, if we adjusted the COLA, and if half the employees went along with that plan, approximately how much of our unfunded liabilities would go away with that reform?
Well, as you know, it's a complex issue, but based on the information we received from the actuaries, we believe that it would reduce the unfunded liability by 10 to 15%.
10 to 15%. So again, just
So
for
$8 to $12
people-
billion perhaps, if you based on 83 billion current unfunded.
Would it be fair to say, and I know then too, you're always guessing what's the growth rate going to be over the future years, which is really impossible to know. One thing we have relative to growth rate right now, as we sit here and we're looking toward a presidential campaign, we have the whole issue of if current tax law at the federal level is going, taxes are going to go up as the Bush tax cut rates go off. Is that at all part of your planning as far as projecting growth, or those with whom you look to at the federal level to say, as you said, 97% of what the federal government or the national economy does is what Illinois does. To what extent should any of us care if the Bush tax cuts are extended or not?
Well, if you look at our analysis, it's one of the uncertainties we point out. There's a lot of uncertainties. You know, the economy, the slowdown in the economy, the uncertainty of the Bush tax cuts. We don't know what the impact will be, but we point out the fact that that's something that certainly we need to look at and that you need to be concerned about. It's just one of those uncertainties out there. So we don't know. We don't know what's going to happen. You don't know what action Congress might take. Same thing with the General Assembly. We never base anything on what might happen. We based on what's current law, and that's the only thing you can look at this point. So we have no idea what might happen at the federal level any more than we do sometimes at the state level. But it is something we point out is something that we need to be aware of, and that the audience that we provide this information to needs to be aware of.
Well, Dan Long, we kept you probably a little longer than we anticipated. It's always a lot of information to share. We appreciate you taking the time to share with us and give us this financial checkup on the state of Illinois' budget.
Well, it's good to be back with you again. Thanks, Terry.
Thank you.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.